Today this story is about how I became a chiropractor. On August 27th of 1986, I made what would become the most important jump of my life. You see, at the time, I was serving as a Air Force Special Operations weather team member assigned to the Army's 10th Special Forces Group. And that day we were conducting airborne operations. It was jump number lucky 13 for me, and due to a combination of cooler weather, equipment that hadn't been tested at that altitude, and ground conditions on the drop zone, the landing went wrong, very wrong. I hit the ground hard. The injuries were fairly severe: a left hip dislocation, fracture of my sacrum, of my pelvis, of the L3 vertebra. And to make matters worse, during the evacuation over a pretty rough drop zone, I developed internal bleeding that later turned into a lower abdominal hematoma. And in addition to everything else, I had left-sided sciatic pain pretty bad. So following a week in the hospital, which included a night in the ICU, I began follow-up care with the orthopedic surgeon out on Fort Carson's Hospital, and his recommendation was to surgically fuse my left sacroiliac joint. Well, even then, without any formal medical training, I remember thinking that just didn't sound like a great idea. So while deciding what to do with that recommendation, I spoke with my younger brother, who had recently graduated and became a licensed chiropractor in Louisiana. He suggested that chiropractic care might help. So when I mentioned this to the orthopedic surgeon, he just really wasn't that impressed. Instead, he recommended physical therapy. And still unable to walk or stand unassisted, I agreed to that. So after a month of physical therapy, I was stronger, but I still couldn't walk without a cane or unassisted in any way, and the pain hadn't really changed a whole lot at that point. So I brought up the chiropractor again to the surgeon. He resisted, suggested SI fusion again, but I was persistent this time, and he referred me to a chiropractor who surprisingly was in the same hospital that the orthopedic surgeon operated out of. Up to that point, I'd never had a chiropractic adjustment in my life. On the first visit, he adjusted my pelvis and lower back, and I actually remember thinking then that I felt better. From there, things began to change. After about a month, I no longer needed a cane. Over the next few months, I continued to improve to the point where by May of the following year, I had regained enough function to pass the airborne physical qualification test and be reinstated to jump status again. But something else had happened during that recovery period. I had become a believer in chiropractic, not because someone told me to, but because I had lived it. I experienced firsthand what chiropractic could do when surgery was the next option and nothing else had worked. I knew then that someday chiropractic would be a part of my future in some way. Well, that someday came at the age of 50 when I went back to school and made that dream a reality. I've now been in practice for nearly 15 years, and one of the most meaningful parts of my career today is that I'm a provider for the Veterans Administration Community Care Network. That allows me to give back to help veterans that are living in pain and struggling with daily activities that once defined their lives. So helping them regain function and improve their quality of life isn't just what I do, it's personal to me. What started with a bad landing on a jump number 13 ultimately led me to a profession where I get to help others get back on their feet every day. And you know what? I wouldn't trade that path for anything.
So my chiropractic story starts with soccer. I played soccer my whole life from age 5 all the way through college. And doing that, I always had to deal with sports medicine staff and athletic training staff, and I was really impressed with how they were able to keep us playing, keep us on the field. So that was always going to be my plan B for what I wanted to do in life. Plan A was soccer. Going into college at Penn State, that wasn't as much of a pipe dream as it seems to have been now in hindsight, but that was what I was going to do, was play professional soccer. Plan B was at first athletic training, but I found out that that interfered with soccer too much, so I quickly changed over to physical therapy. And after pursuing all the prerequisites and some internships, really the only thing that interested me in physical therapy was the diagnostics. There's a day where the therapist I was working under, he did a neurological exam, and I thought, wow, how did you know that that patient had that exact problem? And he explained to me how the exam works and how they can pinpoint what level of the spine the problem was at, and I thought, wow, I guess it's diagnostics that I really enjoy. Right around that time, I don't know if everybody knows this story, but Sam, Dr. Mayfield, is my father-in-law, and my wife, Lisa, and I, at that point of my life, we had already been dating for several years, and we were engaged at the time, so I had already been in and around the family for a long time. And when I decided, you know, physical therapy is not really what I want to do, Doc had just been starting up at Logan Chiropractic College doing some of his prerequisites. So I went down to St. Louis and checked it out and realized, yeah, this is what I want to do. We started together, I guess it was January of 2008, and go through school together, sitting 2 people apart for all that time. We get out of school and we decide, you know, Louisiana is where we're going to land. And the plan at the time was, we'll probably be here for about, you know, 3 years or so, get our practice up and running, and move back to Colorado, where we both had, I grew up, and Doc had some roots as well. Well, what we learned was, when you set up such deep roots as we have here now in Louisiana, it's really hard to leave that. So along that time of going through school and starting a family and being able to treat my kids, treat my wife Lisa during some of her pregnancies, it had really become clear the type of chiropractor that I wanted to be. It was a sports focus, it was, you know, some pregnancy related care and just things that we had already done I think a good job of treating. I guess it was around the summer of 2012, Lisa got really sick, and we were searching for answers and not really finding them anywhere. And I remembered in school, the people that sat around me were into this thing called functional medicine. So I called up one of them and I said, tell me, like, what do I need to know about functional medicine? And she, little did I know how deep that question was, but she kind of got me on the right path. During that time, I really changed my focus of where my attention went, where my studies went, and really hit the books hard on learning what this whole functional medicine thing is. So I started learning some things and started implementing them, not just with Lisa, but in the practice, and we start seeing people get a lot better. So I thought, wow, there's really something to this. In a nutshell, that's how we have built the practice that we have now. Is we have needs in our own life. We see where these needs may not be addressed as well as we hoped, and we try to see if we're the people to fill those needs. And that's kind of become one of the rallying cries of us here at Mayfield Chiropractic, is build what you wish existed. And more every year, we have more patients that have needs. They tell us what their problems are. We try to find answers, and you know, not everybody gets better, of course. That's not how healthcare works, but you know, we've built a practice on that. So I hope we can continue doing that, and you know, we're grateful for the opportunity to have done that so far.